GBMC Healthcare.
Well, you've heard it 100 times, but it doesn't hurt to hear it again.
That's right. There's no doubt that you should get your flu shot. And here to tell us why, again, is Dr. Samantha Ober from GBMC. Welcome.
Thank you. Thank you for having me.
All right. So colds and flu are spreading right now thanks to holiday gatherings and all of that. So talk to us about the flu shot. Do we need it?
Sure. Absolutely. Yes. So we know the most effective way to prevent the flu is by getting the flu shot. The CDC recommends it for everyone 6 months old and up. And that's going to be a flu shot that you get once a year.
Okay, so what if we already got the flu this year? Should we still get the flu shot?
Absolutely. So the flu shot is protective even if you got the flu last year or this year. It's going to help you, protect you from getting it, and then also it can help decrease the severity of it if you do get it.
Okay, and so then all online, at all the gatherings, and everybody's saying you get the flu from the flu shot. True or false?
Yes.
False, okay? This is the #1 question I get from all my patients and their biggest concern. You cannot get the flu from the flu shot.
Okay.
So the flu vaccine, it contains a killed, inactivated virus or just bits and pieces of the virus. So all it does is it exposes your body to it. You mount an immune response, but you can't get an infection from it.
Okay.
So it's very safe.
So every single year we hear that the flu virus itself is a little bit different.
Yes.
And so the vaccine itself has to be changed, correct?
That's correct, yes.
So how effective is this year's flu vaccine batch?
That's a difficult question. It's really difficult in the current season to say how efficient it's going to be. The CDC does a lot of research because you're right, there are different strains of the virus and they're always changing. So we always years prior to help make this year's vaccine as best we can. So I can't give you an answer right now, but I can tell you there's a ton of research backing up that this, to the best of our ability, this is the best that we know will help with coverage.
Okay, so let's talk about traveling. I was just on an airplane and I was like, I heard somebody sneeze and I was like, how do you protect yourself from the flu when traveling this holiday season?
Yeah, so it's going to be very difficult. You're in close quarters on an airplane or on a couch with family. Trying to just avoid people who seem sick is going to be the best way. If you yourself are sick, covering your cough, covering your sneeze, doing the best you can, wearing a mask if you have it available would be great to help prevent spreading to others.
So if you end up getting the flu, how long am I expected to be down for?
Yeah, so the flu can vary depending on the person. Sometimes it's a mild illness for a few days, sometimes lasting up to 2 weeks. We do know that there are certain populations that are at higher risk for more severe illness. So those are young children, the elderly, pregnant women, and then anyone with underlying health conditions, so lung conditions, heart conditions. They may have more serious complications. It can even be fatal, and that's why, again, so important to get your flu shot.
So how do you tell the difference, right? So my 11th grader came home, he had symptoms. I was like, quarantine yourself. I don't think it was the flu, but how do we know the difference?
Right. It can be hard to tell the difference. So the virus is like any other respiratory infection. So you get coughing, sneezing, sinus congestion. With the flu, you're more likely to get fevers, pretty bad muscle aches and pains, and then pretty prominent fatigue. So that might kind of tell you something more is going on.
Okay.
Yeah.
So if we do get the flu, what are some things we can do to reduce all of those symptoms?
Right. So there is a medication that if we give within the first 2 days of symptoms, it can help reduce the severity. So, go see your doctor if you think you're sick with the flu, and we can test you for that and give you that medication. The other thing would be, staying home from work, getting plenty of rest, staying hydrated. But unfortunately, with viruses, you just kind of have to wait it out.
Right. So everybody out there, if you don't have one, all the information is right there on the bottom of the screen where you can find Dr. Ober. Thank you so much for being here with us
Yes, thank you for having me.